8 signs in your body that your heart gives before it dies. Ever wondered if your heart is as healthy as it should be, or if there might be trouble lurking within? Did you know that cardiovascular disease stands as the foremost global killer, claiming countless lives each year? It's a sobering fact that underscores the urgency of understanding the subtle indicators of potential heart issues. Let's navigate through this vital information in 3 detailed segments. Firstly, we'll unveil the 8 telltale signs indicating potential heart issues, urging you to observe closely. Then, we'll explore the classic symptoms that could be silently signaling distress within your heart. Lastly, we'll equip you with invaluable tips to safeguard your heart's future. This journey promises to be enlightening, so stick around till the end. Before we dive in, a small request. A simple like can amplify this message, reaching those devoid of medical assistance. And remember, sharing is caring. It could save a life. Now let's embark on this exploration together. All right, enough chit-chat. Let's get down to business. So do you think you might have a heart condition? Where in the world are you tuning in from? Let us know in the comments below. 8 signs your body might be sending. All right, now we're diving deep. Here are the 8 sneaky signs you might want to keep an eye out for. Sign 8, sexual dysfunction. Erectile dysfunction in men and decreased libido in women can sometimes be early signs of heart disease. Sign 7, the earlobe whisper. Forget palm reading. This one's all about your ear. There's a little crease some folks have on their earlobe, and it might be trying to tell you something about your heart health. This diagonal fold is called Frank's sign, and it could be a clue that the arteries supplying blood to your heart are blocked. Now, it's not a guaranteed indicator, but it's definitely worth mentioning to your doctor, especially if you're on the younger side. Sign 6, where'd the leg hair go? Ever notice your leg hair thinning out, especially on your shins and thighs? This could be a sign of a not-so-secret problem, clogged arteries in your legs. Because these arteries are kind of like cousins to the ones feeding your heart, poor circulation in your legs can also mean trouble for your ticker. The reason? Less blood flow means hair follicles aren't getting the nutrients they need to grow nice and strong. Sign 5, yellow eyelids, not a fashion statement. Those yellow plaques you might see around people's eyelids, they have a fancy name, xanthelasma, and they're a deposit of cholesterol. While they're not dangerous themselves, they can be a warning sign for high cholesterol and triglycerides in your blood. And guess what? High cholesterol ups your risk of heart disease. So, if you see these yellow patches, it's a good idea to get your cholesterol levels checked. Sign 4, not so golden rings around your eyes. This one's a bit age-related. As we get older, some folks develop a white or gray ring around the colored part of their eye called arcus senilis, or arcus corneae. Normally, it's nothing to worry about. But for younger people, it could indicate very high cholesterol levels, which again, increases your risk of heart disease. Sign 3, the blues, not the happy kind. We're not talking about feeling down, but about your skin turning a bluish or purplish color. This is called cyanosis, and it can happen due to poor circulation caused by a heart or lung problem. If this bluish tint shows up when you're warm, it suggests that part of your body isn't getting enough oxygenated blood. Sign 2, leg sores that just won't heal. Slow-healing sores on your legs or feet could be a sign of poor circulation due to blocked arteries. These ulcers are typically painful, but nerve damage from conditions like diabetes might mean you don't feel them. Sign 1, puffy ankles and legs, not just after a long flight. Fluid buildup caused by a weak or enlarged heart can lead to swelling in your lower extremities. This puffiness is often worse at the end of the day and tends to improve when you elevate your legs. Remember, these signs are just clues, not a definitive diagnosis. If you experience any of them, it's crucial to see a doctor for a proper evaluation. Stay tuned because next up, we'll be uncovering the 7 classic symptoms that could indicate your heart is struggling. 7 classic symptoms your heart might be having. All right, folks, we tackled the sneaky signs your body might be whispering. Now let's shift gears and talk about the more obvious ways your heart could be trying to get your attention. Here are the 7 classic symptoms you shouldn't ignore. Symptom 1, feeling short on breath? This one's pretty straightforward. If you find yourself gasping for air, especially when you're exerting yourself, It could be a sign your heart isn't pumping as efficiently as it should. This breathlessness that gets worse with activity can be a red flag for heart trouble. Symptom 2, a cough that just won't quit. A persistent cough, especially one that produces white or pink phlegm, could indicate fluid buildup in your lungs or air sacs. Don't brush this one off. See your doctor to get it checked out. Symptom 3, sleeping upright just doesn't cut it. Do you find yourself adding more and more pillows to your bed just to catch some decent sleep? Maybe you even end up sleeping in a chair because lying flat makes you feel breathless. This could be a symptom of heart failure where your heart can't pump enough oxygenated blood throughout your body. Symptom 4, feeling like a wrung-out dishcloth. Ever feel wiped out all the time, like you can barely manage everyday tasks? This generalized weakness can be a sign your heart isn't pumping enough blood to meet the needs of your muscles and tissues. Basically, your body isn't getting the fuel it needs to function properly. Symptom 5, nighttime bathroom breaks. More than just too much water. Do you find yourself constantly getting up to pee throughout the night? This frequent urination at night, called nocturia, can have various causes. But if your heart isn't pumping properly at night, excess fluid can build up and needs to be expelled. Symptom 6, painful calf cramps, not just after a workout. This one might surprise you. Feeling pain in your calves when you walk a short distance could be a sign of intermittent claudication. This pain happens because the blood flow to your legs is restricted. When you stop walking, the pain eases up. It's your body's way of saying, hey, something's not right down here. Symptom 7, chest pain. Don't ignore this one. This is the big one. Chest pain, pressure, heaviness, tightness, or burning. Any discomfort in your chest that lasts more than a few minutes could be a sign of a heart attack. It could also radiate to other areas like your arm, neck, back, jaw, stomach, or elbows. There might be additional symptoms like sweating, paleness, nausea, or dizziness. If you experience any of these, don't hesitate. See a doctor immediately. Remember, early detection is key. If you're concerned about your heart health, don't wait. See your doctor and get checked out. Coming up next, how to keep your heart happy and healthy. We've covered a lot of ground today, but don't worry, there's hope. In the next part of this video series, we'll be diving into some simple lifestyle changes you can make to keep your heart happy and healthy for years to come. So stay tuned and don't forget to like and subscribe for more valuable health information. What can you do to keep your heart ticking strong? All right, everyone, we've explored the secret signs your body might be sending and the classic symptoms that could be a red flag. But fear not, there's a lot you can do to keep your heart healthy and happy. Let's dive into some simple lifestyle changes that can make a big difference. Get moving. First and foremost, get your body moving. Sitting all day is a heart health no-no. Physical activity is crucial for good circulation, overall heart health, and your mental well-being. Low-impact exercises like walking, biking, or swimming are excellent choices. They improve blood flow and help manage chronic blockages in your veins and arteries. Kick the butt. Smoking is one of the worst things you can do for your cardiovascular system. It inflames your arteries, forms fatty plaques, and increases your risk for heart attack, stroke, and even dementia. So, if you smoke, quitting is the single best decision you can make for your heart health. Shed those extra pounds. Carrying excess weight puts a strain on your entire body, including your heart. Being overweight or obese raises your blood pressure, worsens your blood sugar, and increases your risk of heart disease. So, if you need to shed some pounds, focus on a healthy diet and regular exercise. Fuel your body right. Nourish your heart with a healthy diet rich in fruits, vegetables, fiber, whole grains, and olive oil. Limit red meat and processed foods. Here's the key. Focus on whole, unprocessed foods that give your body the nutrients it needs to thrive. Know your family history. If you have a family history of heart problems like heart attacks, strokes, or heart surgery in parents, siblings, or close relatives, be extra vigilant. You might need more frequent monitoring and testing. Discuss your family history with your doctor and create a personalized plan to keep your heart healthy. Cholesterol control is key. High cholesterol is a major risk factor for heart disease. Watch your cholesterol levels. Eat more oats. Cut back on trans and saturated fats and manage your weight. Exercise can also help lower your bad cholesterol, LDL, and increase your good cholesterol, HDL. Sometimes, even with a healthy lifestyle, medication might be necessary. If your doctor prescribes cholesterol-lowering medication, trust their expertise. They are working towards protecting your heart health. Keep your blood sugar in check. If you have diabetes or prediabetes, keeping your blood sugar levels under control is crucial. High blood sugar can damage your blood vessels and increase your risk of heart disease. Work with your doctor to manage your glucose levels through medication, diet, and exercise. Blood pressure matters. Aim for optimal blood pressure, ideally below 120/80 mmHg. For some individuals, a slightly higher goal may be more appropriate. Your doctor will determine the best target for you. Lifestyle changes like healthy eating, exercise, and managing stress can all help control your blood pressure. Listen to your body. If you're experiencing any of the signs or symptoms we discussed earlier, don't ignore them. Schedule a doctor's appointment and explain what's going on. Follow their medical advice to keep your heart healthy. Like, share, and subscribe. So there you have it. Simple lifestyle changes can make a big difference in keeping your heart strong and healthy. Did you enjoy this video? If so, give it a thumbs up. Sharing is caring, so spread the word and help others learn about heart health. And don't forget to subscribe for more valuable health information coming your way.